Hello, I'd like to begin this series of Lyme disease pain, the 90 types of pain I've seen in my practice, with a story. I had a patient who didn't know he had Lyme disease until the pain took over. The mystery was, why didn't the pain make sense? It burned, moved, and flared after rest. There was no diagnosis, just confusion, but it turned out to be Lyme disease. There was burning in the hands and feet, electrical shocks in the spine, light touch hurt. This is the possibility of small fiber neuropathy, which is seen in Lyme disease and other conditions, but part of the workup. The patient also had pain that jumped from joint to joint. This is the migratory pain that sometimes happen to Lyme patients. The thumb hurts. Sometimes I've had people, even the saddle of the thumb hurts. The knee, wrist, sometimes it's only one joint. X-rays were normal as part of the evaluation. This is a migratory Lyme arthritis type presentation. The patient also had pelvic pressure, bloating after meals, told it was stress. This is part of the autonomic nervous involvement, which is normally seen in POTS, positional orthostatic tachycardia, but it's also seen on its effect on the gut. Sensory overload issues also emerged. There was head pressure, sound sensitivity, even brushing the teeth triggered pain. No findings on scans, no finding on evaluations. This is part of something I often see, which is Lyme-related sensory issues. The patient also had a Herxheimer reaction. That is, he had a flare-up after starting the antibiotics, but he also had flare-ups at other times related to like stress and other kinds of activities. This is something they see in Herxheimer reaction, and sometimes it tells a patient that they're beginning to start a recovery. So the lesson that we have here is that pain that moves, burns, defies explanations get dismissed. At least Lyme disease is a consideration. So in closing, I'd welcome you to subscribe if you haven't done that already. Leave comments down below if you're struggling to explain your symptoms or you have some thoughts on the subject, and follow along as we dive into 90 types of Lyme disease pain that I've seen in my practice, one video at a time. Thank you for joining me. Have a good day.